Hi, everybody. I'm Congresswoman Lauren Underwood, and I have the honor of representing the 14th Congressional District. I am joined today by two very special guests who work on the front lines of an issue that is close to my heart, which is healthcare affordability. Many of you know that protecting healthcare and making healthcare more affordable inspired me to run for Congress. And the American Rescue Plan includes the largest expansion of healthcare coverage and affordability in over a decade. This is real dollars in the pockets of Illinois families at a time when people need financial relief the most. These are policies that I've been fighting for since I was elected to Congress, including my Healthcare Affordability Act, which lowers out-of-pocket costs for marketplace plans, specifically the premium price. So before we get into our discussion of what this will mean to our community, I want to provide a bit of background on the healthcare provisions in the American Rescue Plan that are going to lead to real savings. President Biden signed the American Rescue Plan into law in March, and it's already helping to speed up vaccinations, put money in pockets and people in jobs, and keep kids in schools safely. You can find the details on the new law on my website at underwood.house.gov. We have a whole page dedicated to what's in the American Rescue Plan and what it means for the 14th District. Because of the inclusion of my Healthcare Affordability Act, families in our district will see lower out-of-pocket healthcare costs through expanded premium tax credits, which Americans use to purchase Affordable Care Act plans on the health insurance marketplace. The lowest income families and those who qualify for unemployment insurance would have their premiums eliminated. And other hardworking families will save hundreds or thousands of dollars a year. Families who currently make too much to qualify for tax credits, but still struggled with the high cost of care, will now pay no more than 8.5% of their income on premiums. For families in Northern Illinois who had been paying 15, 18, or 20% of their income on healthcare, this is real savings that matters. Uninsured couples earning over $70,000 could save more than $1,000 a month on their monthly premiums. And a family of four making $110,000 per year in the 14th Congressional District could save more than $7,500 a year on premiums. I want to encourage everyone that wants to hear more specifics on what's in the new law to check out the video I did with the Kaiser Family Foundation, where we break down exactly what's in the American Rescue Plan that will lower healthcare costs. To see savings right away, people are going to need to take action, and we want to make this as simple as possible. There are people ready and willing to help us, and you can connect directly with the Marketplace Navigator. They're equipped to help consumers look for healthcare coverage options through the Marketplace. They can even assist with eligibility and enrollment forms, all at no cost. You can connect with a local navigator at localhelp.healthcare.gov. Now, this video is all about what those changes means for our community, for our neighbors, because this is an issue that touches us all. In my years of talking to constituents and community groups, I don't think I've come across a person who hasn't been touched by unaffordable healthcare costs. And guess what? Our guests today know this well. So I'd like to introduce them. First, we have Kara Murphy, the president of DuPage Health Coalition, and Suzanne Hoban, the executive director of Family Health Partnership Clinic in Crystal Lake. I am so glad to have you all here today. Could you start by each sharing a bit about yourselves and your organizations?
Sure, my pleasure. My name is Kara Murphy. As you shared, I'm the president of the DuPage Health Coalition. We coordinate a host of patient-facing programs that are really designed to address barriers to health access and to make health care more affordable and accessible to especially low-income, uninsured, and underinsured residents of the community. So you can imagine just how excited I am to talk about this topic with you today.
Thank you, Kara. We so appreciate your time. Hi, Suzanne.
Good afternoon, Congresswoman. It is lovely to be here, and it's lovely to be with my friend Kara as well. So I'm the executive director of the Family Health Partnership Clinic. We're located in Crystal Lake, and we are a clinic that is designed to care only for the uninsured. We recognize that there are a lot of plans that have been put into place, such as expanded Medicaid, which is very important. as well as some of the provisions in the American Rescue Plan. And we're thrilled to see that perhaps we will lose some more patients to being able to get insurance once this fully rolls out and once we're fully able to let people know how to take advantage of them.
What a sentiment. So I want to dive right in with some questions on healthcare affordability and the provisions of the American Rescue Plan and what those will mean for our community. So first, let's start with you, Suzanne. As you mentioned, you're the executive director of the Family Health Partnership Clinic in Crystal Lake. Tell us about the people that you serve. What are the barriers that they face in terms of affording healthcare?
Absolutely. Well, again, we serve only the uninsured. So they can't have Medicaid, they can't have private insurance, they can't be on Marketplace. And we are so excited when we're able to help people find those resources. And for our patients, most of our patients are working, but they're working a few part-time jobs hobbled together, or they may be working in a sector that's been adversely affected by the pandemic. And so some of the provisions in the bill that are going to really help our patients really focus on those people who tend to fall through the cracks. They make too much to qualify for Medicaid, but they simply can't afford the premiums in the Marketplace yet. And this is huge because so many people want to be responsible and take care of their health and the health of their families. But if we're not able to provide the tools to do that through good, comprehensive health insurance, it's very difficult. And so that's why our clinic is so excited about this, because so many of our patients who fall in those cracks will be able to take advantage of this and finally get health insurance.
And so the law is so meaningful for your clientele, I'm sure.
Very much so. Very much so. It
and
is.
Kara,
It will mean the difference for some people being able to come here and being able to go to a private physician, which is huge, which is what we all hope that we are able to do at some point, which then frees up the space for our clinic to be able to care for those who have absolutely no other access to health care. That's important to us, and that's important to our patients.
Thank you, Suzanne. Kara, same question for you. Tell us about the people who come to the DuPage Health Coalition for assistance.
So I think I shared prior that broadly our focus is really on addressing barriers to health access for individuals who are low income here in DuPage County. Some of those individuals, exactly as Suzanne described, are individuals who don't meet the guidelines for any of the other programs that are available, like Medicaid, Medicare, employer-sponsored benefits. But before the Affordable Care Act launched, we actually served about 12,000 patients a year in my program. And after the ACA, there were about 6,000 patients who continued to be uninsured and need our Access DuPage program. But one of the things that we learned was that while we had an increased number of patients we were very excited to be able to link to insurance, for those whose income was just a little bit too high for Medicaid, there were still some pretty significant barriers. And so we launched a program called Silver Access about 5 years ago that was intended to provide some extra levels of assistance for individuals who are low income, insurance eligible, Marketplace eligible, but who still needed a little bit of help to gain access to a high quality plan. Many times because their income was so low, and similarly, we're talking about primarily a working poor population. Because their income was so low, they were oftentimes very premium dependent, and they were making selections of plans exclusively on the cost of the premium because that money was so precious to them and was needed for so many other things in their lives. But sometimes those plans weren't necessarily the perfect fit because the out-of-pocket costs at their income level were really formidable, and it was causing them to not seek access to the care that they needed. One of the reasons why I'm so excited about what you're offering with the affordability under the American Rescue Plan is that for so many of those families, they'll be able to make the choice of a plan that's really the best fit for them, rather than the plan that is the lowest cost, because those cost factors are going to be, while still present, much less acute. So grateful and excited about that element.
That's so powerful. So, listen, I want to hear from both of you on this. Why is this work so important to our community? And why are you passionate about serving your clients? Let's start with Kara and then Suzanne.
Well, it's hard, and it probably feels like for most of us, we spend a lot of time talking about COVID today. But COVID did not create the health disparities that we see in our community. What it did is it shone a spotlight on those disparities. And it is critical that for every family here in DuPage County and district in the 14th district, that people have access to high quality care in a timely way, that they can manage preventable illnesses, that they can manage chronic diseases. Tragically, one of the things that we've seen is that the folks that were disproportionately hard hit, both with rates of infection and unfortunately with poor health outcomes through this COVID pandemic, were individuals that were living with chronic illnesses and perhaps not able to adequately manage those chronic illnesses. And so if we've learned anything from this process, and I wish that we hadn't had to go through this to learn it, it's that it's really important that we make sure that everyone has access to high quality care all of the time, not just in a moment of crisis, because the work that they do on an average Wednesday or Friday to take care of their health is going to ultimately serve them both that day, but also for months and years to come, and ultimately also serve all of our community.
Thank you. Suzanne.
I'm passionate about this work, but a lot of people think that we're in it for the warm fuzzies, for being able to help people who need help. I really look at it as an economic argument. We in the United States spend the most per capita of any country in the world, over $10,000 per capita, and yet we have some of the worst outcomes in the world. We like to think of ourselves as great shoppers, great consumers. Well, we're not getting enough for our money. This is a big issue. And the problem is that we oftentimes spend so many of those dollars on the back end and sort of in a backwards way, rather than getting people access to care early, often, and consistency. And that is the efficient way to provide health care. And so if we can get them their diabetic medications, if we can get them in for screenings, if we can provide them those antibiotics before it turns into a full systemic infection, that saves money down the road. This is truly an economic decision. This is not just warm fuzzies. And when health care is not available to everybody, we all pay for it. And we pay for it through higher hospital costs, higher insurance costs, and higher state tax costs. So that's my passion.
Thank you. Our ultimate goal here is to get everyone quality, affordable coverage, but being uninsured isn't just a financial burden. When someone doesn't have access to affordable care, there's a mental and physical cost too. So what do we see in the impact of an individual who doesn't have access to insurance? Suzanne, can you address that?
Absolutely. In fact, I can talk about one of our patients that we had who was double hit by the COVID pandemic. The first thing is that both she and her husband, who were renting space in a large house, were both hit with COVID and had to quarantine. The rest of the people in the house didn't want COVID in the house, so they kicked them out. We were able to set them up with an apartment to be able to get and to be able to quarantine. But then the husband lost his job and he was no longer able to afford the rent on the apartment. So now we have people who are in very vulnerable situations health-wise, losing their apartment, losing their job. All of this really snowballs into an effect that many people have those safety nets that they can rely on, but an awful lot of people don't have the safety nets, so that one misfortune or tragedy can simply snowball into an entire series, leaving families literally homeless, jobless, and without a place to turn.
It's devastating. But what about at the community level? What benefits do we see collectively when all of our neighbors have access to affordable care? Kara, can you speak on that?
Sure. So when we think about community and we think about sort of the holistic health of what creates a healthy community, DuPage County, very proud. Kane County should also be celebrating that we've been deemed some of the healthiest communities in Illinois. And I think that it is not an accident that we're having this conversation in your district, and we're having this conversation around why it's so important at the community level that we invest in healthcare. When we talk about an adult who is uninsured, you have to represent that they are in the context of a family. So if mom and dad can't maintain their own health, that means that they can't, as Suzanne referenced, continue to go to work. They can't provide for their families. There are consequences certainly for their mental health and their physical health, but also for their children and for the entire family. And the fragility of that and our capacity to invest meaningful targeted dollars as a community, as a nation, in ensuring that cascade of bad outcomes is interrupted with the presence of high quality health access and affordable health insurance is really where we start to build a healthy community. It's a foundation, it's the architecture of what we need to be able to continue to make and see gains.
Yeah, but this issue has always been important. But during a global pandemic, it's critical. Why is affordable healthcare even more important than ever? And I'd like to hear from you both on this one. Let's start with Suzanne.
Well, being sick is really expensive, first of all. We have a number of patients, and I know that you, Congresswoman, and Kara, and all of your listeners have seen and heard about the COVID long haulers, for example. Even people who may not have been sick initially with COVID, a lot. They may have been down for a couple weeks, but were never hospitalized. There are recurring illnesses and recurring symptoms that are happening a week, a month, a couple months after COVID, because we simply don't know enough about what systemic impacts that virus has on our bodies. And so if you have no insurance and you're not able to get some of these other issues addressed and taken care of and monitored, we really don't know what that long-term sequela is going to look like. Patients, particularly during a pandemic, and particularly those who have had COVID, need that consistent monitoring, consistent testing, and watching so that as these symptoms develop, they can be addressed and dealt with so that patients can stay employed, can stay as functioning and healthy members of our community.
And Kara.
I'd like to add to that really over the course of the last year, we've been living through a dual pandemic. And we tend to focus on the consequences of the devastating consequences of COVID-19 on our physical health, on individuals who passed away much earlier than they should have, or as Suzanne referenced, individuals who continue to experience long-term side effects. But similarly, we also had an economic downturn that has really been devastating and for some communities unprecedented. And so what that means is that the reason that this assistance is so timely today is that we have whole industries where individuals might previously have had reasonable access to affordable employer-sponsored health insurance, for example, but they can no longer work full-time in that industry. And until we see full recovery, they're going to continue to struggle. And that's why this assistance today is really so timely and so helpful to give people the ability to have the insurance that perhaps they once had, but have lost over the course of this last 12 to 14 months as a consequence of the economic pandemic that we've been living through.
Yep. And one of the things that's important to note is that the savings in the American Rescue Plan for healthcare, well, they're not automatic. People will need to take action. So what are some of the barriers that we face in just letting people know about these savings? And how can we all contribute to getting the word out?
I think go ahead, Suzanne.
Sarah.
Suzanne, let's go. You're on the screen with me, so yes.
Alrighty. So I think that a couple of the things that we are going to be doing is doing much more training with our staff to be able to talk about this with our patients as they come in. We have seen an unprecedented number of new patients coming in, people who never thought they would need our assistance. But like Kara said, the economic downturn has left them without insurance and without benefits. I particularly want to focus on some of the pieces of the plan that deal with COBRA, because COBRA is a great opportunity to be able to purchase insurance after you've lost your job, but at rates that are $1,500, $2,000, $2,500 a month. I don't really see how someone without a job can afford that COBRA coverage. And so that's a really critical piece of this plan, and one that I think many of our patients will be able to take advantage of and utilize, and we'll begin starting to get outreach to both of our patients, our staff, and then our community supporters about how they do need to take action, though, to look and see if their premiums have gone down or if they're eligible for the subsidized COBRA.
Yep. And even the COBRA part takes action. Communicating with that former employer, making sure that those payments are going to be covered, et cetera. So none of this is passive. We need consumers to be paying attention and connecting with the resources available to them locally. Kara, what do you think?
So a few of the things that I'm really excited about, and I think also some of the places where we really need to invest time, energy, and attention. First, I'm really excited to see that there was an infusion of capital in some marketing campaigns that really are intended to get the word out. I think that people find health insurance, as a rule, bewildering and confusing. It's jargony. There's a lot of numbers and graphs and tables, and each person's situation tends to be very specific, and people's eyes sort of glaze over when you talk about it. And here we are in a situation where we have things called SEPs and special enrollment periods and premiums and deductibles, and a lot of information that even under the best of circumstances, people tend to struggle to wade and sift through. So I think it's going to be critical that we do some really targeted marketing. I think outreach at the individual level, and I think investing as nonprofit organizations, as healthcare organizations, really making certain that we're reaching out and inviting people into that conversation and not presuming that everyone understands what they qualify for. The other piece that I think is a little challenging right now is that, time was that someone could simply get in their car, drive over to a particular location, open the door, and talk to someone face to face about the questions that they have. And now we really have to get creative about the ways that we help people through the process. As you shared, Congresswoman Underwood, this is a process that doesn't happen passively. It's not really that difficult for people to sign up, but they need some instruction. And for some people, they're going to need some technical support. And so I think that really over the course of the next several months, and as soon as possible, our job is going to be to help make that navigable for everyone in our community, and also make sure that everyone knows that there is help available so that they can take advantage of the resources out there.
So I want to continue on what you were just saying. I know that this might be overwhelming for some of our viewers. And so, literally, where can people go for help? Where should they turn?
So you had referenced a website earlier, and that sounds like it's a pathway that would get people to the local resources that are available to them. But I also want to tell people about Get Covered Illinois, which is another website that people can use. I'm going to actually encourage people to just Google Get Covered Illinois, because it's easier to remember than the website itself. But if you go in there and you enter zip code, you will be able to find a host of local navigators that at no cost to you will be able to walk you through this process. If you're not enrolled in a marketplace plan right now, it's worth taking a look, because you really may be surprised at how affordable that plan is. If you are enrolled in a plan, you still want to go back on and walk through this process again. There's just a couple of steps to the process, but in doing so, you could be saving a significant amount of money. And perhaps even getting your premiums down to zero. The other piece that really is new that had been referenced earlier is this idea that if you've been unemployed in the prior 12 months, or if you're experiencing a reduction in employment and have qualified for even a week's worth of unemployment assistance over the course of the last period, you may qualify for some extra benefits during this pandemic. And people don't know about that. That's not top of mind for them. But if they go to Get Covered Illinois and walk through that process, if they reach out to my organization, if they're a DuPage County resident, and call Access DuPage and find out about our Silver Access program, we can not only help you to navigate through the services that you qualify for, but we can also ensure that you're getting all of the benefits that are available through the American Rescue Act.
Thank you. Suzanne, did you have any other resources that you wanted to highlight?
No, I think Kara covered them absolutely beautifully. I wish that we had navigators here that would be able to walk through the sites. Unfortunately, we haven't seen that. And maybe Congresswoman Underwood, that might be a part of your next plan and your bills. Because this is exactly as Kara said, it is befuddling even for those who are well educated and who work in this field every day. You need to really just follow the directions on certainly Get Covered Illinois is a great website. And once you do that, you'll be able to see where you could possibly save some money.
So Suzanne and Kara were referencing these people called navigators. What that means is that these are folks that often work with nonprofits, and all they do all day is help people understand their healthcare options and get connected for coverage. They do it at no cost to that consumer, and they are unbiased, right? They're not getting any kind of like benefits for those referrals. If you are interested in that type of a service, you can actually go to localhelp, localhelp.healthcare.gov, and you can put in your zip code, and there will be a list of those resources that are available here in our community in the 14th district. So that's also a place that folks can go. Now, real quick, before we all hop off, I want folks to know more about the organizations that you all work with and how they can get in touch. So Suzanne, can you tell us a little bit about the clinic and where folks can find you?
Absolutely. So we're located in Crystal Lake, and we serve McHenry County residents only who are uninsured. And we work just like a regular doctor's office. So give us a call, make an appointment to establish care, and we will be happy to see you. We also provide our patients with the medication that they need. We do all the labs here. We have integrated mental health, dental health, as well as social determinants of health and health coaching here. So if you are in need of assistance and uninsured in McHenry County, please give us a call at 779-220-9300, or just Google our name. We'll come up.
Amazing. And Kara, you want to give us the way to find the DuPage Health Coalition?
Absolutely. So DuPage Health Coalition operates the Access DuPage program for individuals who are low income and uninsured, not eligible for insurance. We're similar to Suzanne, except we offer a clinic without walls model. So we enroll people and then we assign them to volunteer medical providers in the community. We also have the Silver Access program, which offers additional financial assistance for individuals who are marketplace eligible. And finally, we have a free pharmacy, the Dispensary of Hope. So individuals who need any of those services or who find themselves uninsured and not sure what they qualify for can call us at 630-510-8720 or visit us at www.accessdupage.org.
Well, Kara and Suzanne, thank you for taking the time out of your busy schedules to be with us today. I really appreciate all the information that you've shared with our community across the 14th district, and quite frankly, all the work that you're doing with the DuPage Health Coalition and the Family Health Partnership Clinic across our communities. Thank you everyone for watching. I know that we still have obviously way ahead of us before we return to normal, but I am committed to doing this work on behalf of all of you, right? We're still in the fight together. So please reach out to my office if you have any questions. You can find us at 630-549-2190 or at underwood.house.gov. And don't forget to check out our other videos to learn more about the healthcare provisions in the American Rescue Plan and how you and your family may be able to save money. Take care, everybody. Stay safe.